We want to go back to testing for just a moment. The drive-through line on Lowry is absolutely the way to go if you need an exam for coronavirus.
Of course, it's easy for us to say. We're in Denver, just a few miles from what is currently the only facility offering this service.
So what should you do if you're homesick in Fort Collins and you don't want to risk a trip to the doctor's office? As Denver 7's Nicole Brady shows us in tonight's 360, you could always try telemedicine.
We've all done the drill at the doctor's office. The waiting, the weigh-in, and an up-close and personal exam. But more doctor's visits now mean visiting a website with names like Hey Doctor and Doctor on Demand. Telemedicine, once seen mostly as a solution for rural communities, is now being used by people everywhere. So are virtual visits replacing the in-person doctor's visit? For a full 360 look at this, we talked to online providers, a traditional primary care doctor, a mental health expert, a school district doing healthcare in a new way, and of course, patients. When CU Boulder student Jack Bolgard came down with a sore throat, he wasn't sure where to go.
I'm from Pennsylvania, so I usually just go through doing medical things there.
Instead of finding a doctor in Boulder and hoping they'd have an opening, he set up an online appointment with American Well, a Boston-based telemedicine company with 6,000 providers, including specialists, all who see their patients via video chat.
Oftentimes, these patients have already tried to reach out to their primary care physician. They put the call in and they've been told, hey, we have no visits.
Dr. Mia Finkelstein says the most valuable feature of telemedicine is the immediate access. For Jack, he just opened wide and got a diagnosis the same day.
She knew right away, okay, yeah, there's white spots in the back of your throat, you have strep throat. It was very convenient because I could just go in and pick up my medication that day rather than missing probably an extra day or two of school.
Another benefit of telemedicine, privacy.
They don't have to leave their home. They don't have to worry about anyone else seeing them.
Mo Keller, Director of Advocacy for Mental Health Colorado, says this is a huge benefit for people seeking behavioral health treatment, and telepsychiatry is taking off.
People open up more when they're in their own home. They can have a conversation where they feel much more comfortable, especially men.
Then there's the cost. Most of these telemedicine options charge a flat fee. Dr. James Wantuk started PlushCare, a smartphone-based option.
Part of our mission is providing transparency into the process. You know up front what you're going to pay. You're not going to get a surprise bill 6 months later, which is a huge problem in medicine.
So how does the cost of care compare? A Rand Corporation study found telemedicine visits cost around $79 on average, compared to $146 for an in-person doctor's visit and $1,734 for an emergency room visit. But the study also found patients may end up booking more telemedicine appointments, so they may spend more in the end. More insurance companies are covering virtual visits. But some say virtual healthcare is not a replacement for a trusted primary care doctor. Dr. Scott Joy believes it's important to see the doctor in person at least once a year.
I think the biggest challenge with the virtual visits is getting that accurate clinical data. And there is not a visit that I do in any day where I don't get some type of clinical data from having the patient face-to-face.
From a blood pressure check to a heart rhythm and even just being able to observe a patient's movement.
Watching one of my patients walk down the hall, particularly an elderly patient, I can pick up a lot of what's happening. I can look for balance issues. I can look for tremor.
Misdiagnosis is already a problem in medicine, and whether or not a doctor can accurately diagnose certain conditions over video is something that worries patient Peter Bosman.
Being online, while he can see you, but he can't touch you, he can't sort of feel you, he can't do a proper examination.
Both Peter and his wife June prefer the personal touch they get from their regular office visits.
I think you have to have a doctor that you can talk to and you can trust.
So what about a combination? The Poudre School District has implemented a mobile health clinic that brings a physical doctor's office to campus, but inside students connect to a physician over video.
Adelina, did you get ear infections when you were little?
Yes, a lot.
Yeah. A lot, I can tell.
We're not trying to replace primary care models in the community. What we are trying to do is keep these kids healthy enough to stay in school and learn.
We see that there's huge potential to expand access to health care services to students all across the state by using this telemedicine model.
For now, it seems both models have their place, but as more doctors find ways to incorporate telemedicine and advancements are made in both personal health technology and robotics, the future could look a lot different when they say the doctor is in. Nicole Brady, Denver 7.